Okay, you may have an STI and you may not know it. Hey everyone, my name is Dr. Naomi Cave and welcome to Know Her. If you like this video and you like this content, make sure you like and subscribe, it really helps me out. So it's true, as women, we may have a sexually transmitted infection and not even know it. There was a young girl, she had had sex for the very first time with her partner. Her full sexual history included 3 occasions where she had sexual intercourse. When she came to the hospital, she was diagnosed with HIV. I don't mean to scare you. Okay, fine, I do want to scare you a little bit. But what I really want to make sure is by the end of this video, you get an STI check. I've said it once and I'll say it again. I am married and I don't know who told me this, but for some reason I have it in my head that every 3 years I get an STI check. For those of you under the age of 25 who are having sex, it is recommended that you get tested every year if you have a long-term partner or before you have any new sexual partners. Until then, strap up and use a condom. Anytime you have a new partner, it's really important to have an STI check. Even if you have a long-term partner, it's really important that you still get STI checks. And sometimes you can't tell who is walking around with an STI. I remember one of my male friends back in the day, I was telling him about getting STI checks and he looked at me with so much shock. And I was like, have you not just started dating a new girl? Do you not want to, get checked out? And his response to me was, she's clean, she's a clean girl, she looks clean, so I don't need any of that. And I just thought, what do you mean she looks clean? You may not know that someone has an STI, and yet they may still give you one. I think in life, a healthy dose of mistrust is quite useful. The only thing that can protect you from an STD is condoms. Okay, in this video, we're going to talk about how STDs affect women differently to men. We're also going to talk about the common symptoms that you may experience if you experience any at all. And then we're also going to talk about some of the complications that may arise from an untreated STD. Firstly, a woman's anatomy places her at a greater risk of getting an STI compared to men. The lining of the vagina is thin and delicate. That means it's easier for viruses and bacteria to penetrate through the skin and cause an infection. It's moist and it's warm and bacteria love that. So the anatomy already puts us at a greater risk for getting STDs. Secondly is symptoms. Women are less likely to have symptoms. The common infections such as chlamydia and gonorrhea are less likely to show up in women. If they do have symptoms, these can clear away, but the infection still remains. Some symptoms may be a change in the colour of your discharge. So it could be yellow or green. You might have offensive discharge. This means it smells bad. You might have low abdominal pain. These things may be there, but they may not be there. And so you might not ever know that you have an STD. Thirdly, seen as well on the topic of discharge, the fact that we have discharge, we might not be very observant at noticing the slight changes. We also have things like thrush, which is not an STD, but can cause burning and itching sensations. So we might mistake the symptoms of an STD for something more benign like thrush. And actually, I say benign, but thrush is honestly a pain. It is very uncomfortable. Of course, if a man noticed discharge from his penis, he'll be thinking, what is this? And will act on it more immediately and get treatment. Whereas women, if you're not in tune with your body, you might be oblivious to it, or as I said, you might not even get symptoms at all. So let's think about things like ulcers and genital herpes or things like syphilis. These may be in the vagina themselves. You may not be able to visualize them yourself. Whereas a man, it's likely to be on the shaft of the penis and in places which are visible to him. So you might not notice that you have syphilis or herpes, whereas a man is more likely to notice that he has those ulcers. The main risks of STDs, if left untreated, is infertility, the inability to have children because of an untreated STD. If you do happen to get pregnant, having an untreated STD can mean that you have more complications during your pregnancy. Other complications of STDs include increasing your risk of having an ectopic pregnancy. That means a pregnancy where the fetus is growing in the fallopian tube instead of the uterus. Imagine the uterus, it expands like a ball when you have a baby. Your fallopian tube, which is tiny, cannot do that. So as the fetus grows, it's actually very dangerous to have an ectopic pregnancy, and it's an emergency that needs to be treated. So complications of having an STD whilst being pregnant could include having a stillbirth, could have a child that's deaf, a child that's blind, you could have a child with neurodevelopmental problems because of brain damage. It's quite a serious thing to have an STD, but luckily in the UK, once you get pregnant, you get screened for a whole bunch of STDs. We also can't forget that if one does get pregnant, they're likely to pass on that STD to their children. So things like HIV, herpes, syphilis, these can all be passed down to your baby. Also, I just wanted to add here, because of the screening service that we have in the UK, transmission of HIV from mother to child has almost been eliminated. There are also some infections like HPV, which can cause cervical cancer. If you want to know more, check out my other video on cervical cancer and why it's really important to get screened. There's also STDs like HIV. This is a lifelong disease and requires years of never-ending medication. So I'm just doing some research into HIV and women in particular for this video, just as I was editing it, and I just wanted to give you some statistics. So of all the people who have HIV and have been diagnosed from a study in 2017, a third of those were women. Of all those who are newly diagnosed, a quarter of them are women. And of those women who were newly diagnosed, about 57% of those probably got HIV in the UK, whereas the rest got it from abroad. So it is possible to contract HIV in the UK, in case you didn't know. I also just want to add here that in the 2017 study, 2/3 of women who had HIV were Black women. And I guess maybe it's because I'm a Black woman, but I really want to encourage Black women to get tested. For some reason, there seems to be a higher disparity whereby in the past, Black women have been more susceptible to getting HIV. So it's really important to empower yourself to get an STD check, to not worry what anyone else thinks, to not blindly trust your partner, and get checked. Please, for the love of God, get checked. It's also important to remember once again that condoms are the only thing that will prevent you from getting an STI. There's been a recent public health campaign to ensure that freshers in particular, and I think everyone else basically, should not have condomless sex. The numbers of gonorrhea are going up, and gonorrhea is increasingly becoming resistant to antibiotics. So use condoms, don't get super gonorrhea. Just do it. Use condoms and get tested. So I'd just like to end on this note. When I was working at the sexual health clinic as part of my rotation, I came across this man. He was in his late 60s, going on to 70s. He'd been married for 35 years. And I was thinking, wow, a man coming in for an STD check and he's married, you know, good habits. He's just getting a regular check. Anyway, we get into the history and why he's here. He had an amazing trip abroad and enjoyed the local culture. He had fun, and he had fun without a condom. And I think the thing that frustrated me the absolute most is after his trip, he then went and had sexual intercourse with his wife, unprotected of course, because they've been married for 35 years. Why would she then be like, let's have a condom? I guess she might do, let me not judge. But anyway, they had unprotected sex. And then he comes into the clinic with a rash, and now he is very worried. He's worried that he's infected himself, he's worried that he's infected his wife, and probably worried that he's going to get caught. So we do the swab and we do an STI check, and you know, honestly, very glad everything was fine. It wasn't an STI. But after that, I just was so convicted that every single person, every 3 years, I don't care what kind of relationship you have, get that STI or STD check, because I don't want you having HIV because you trusted someone blindly. Lovely seeing you guys and speaking to you guys again. I hope you enjoyed this video, and if you did, make sure you like and subscribe, and I'll see you in the next video. Bye.